Dr. Kelly Conley to you, who has practiced here in Decatur. You can read her bio, but all I will say is I actually went and saw her a couple of weeks ago, and I had this recurring hip pain. She did some dry needling, and like a lot better. So I can go to listen to what she has to say today. Thank you for coming.
All right, thanks. Hi everybody. Thanks Clay for having me here. Yeah, good turnout, so thanks for coming. I just want to start by telling you a little bit about myself. My practice is called Conley Physical Therapy. I run space at Decatur Healing Arts in East Decatur Station, down on College Avenue. I've been practicing for 14 years. I was at Emory for 8 years. After that, I was at a concierge therapy practice. So I worked with a couple of therapists who were on the professional women's tennis tour. There I was able to treat a lot of professional athletes, professional football players, soccer players, marathon runners, ultra-marathon runners, Ironman athletes. So I've really gotten a lot of experience that way. I decided to open my own practice because I basically wasn't able to practice the way I wanted at these other clinics. So I don't know how many of you have been to physical therapy, but if you go to a traditional clinic where your insurance pays, there's a negotiated rate, which isn't very high. So it tends to be a higher volume practice. So this therapist has to see a good 14, 16 patients a day. What that means for you as a patient is you might get 15 to 20 minutes of the therapist's time. And you're still maybe there for an hour, hour and a half. They want you to come in 3 times a week. And so it really doesn't save you a lot of money because you're there 3 times a week, and it certainly doesn't save you time because you're spending 5-6 hours of therapy. So my practice is entirely one-on-one with my clients. So I spend a full hour one-on-one using more kind of highly skilled techniques. So the majority of the session is hands-on. And then I'll give you a few things to work on in between the session that you can kind of do on your own. So it's generally once a week. You spend a lot less time driving, going to therapy, and you tend to get better faster and spend less money doing it overall. Enough about me. We'll get to the butt talk, as I've heard it's been called. So we're going to talk about the glutes today. The glutes have gotten, it's been a big buzzword over the last several years in the running community, in the athletic community, and the medical community. And one of the reasons is that we found that the glutes tend to be weak or shut off or inhibited. And we found through research that a lot of different injuries and ailments are associated with gluteal weakness or inhibition. So bursitis, back pain, knee arthritis, ACL tears, even Achilles tendonitis, plantar fasciitis, all those things are correlated with gluteal weakness or inhibition. So gluteal muscle group is the biggest muscle group in the body by mass. It's comprised of 3 muscles: gluteus maximus, which is the big one back here, gluteus medius on the side, kind of the side of your butt, and then gluteus medius is a little bit smaller and deep underneath that. The glutes have several different functions. So if you think about muscles as kind of like a rubber band or a rope, it has different functions when I'm standing on my leg than it does when my leg is off the ground. So with my foot off the ground, if I have a muscle that goes from my pelvis down to my thigh bone, if I pull that string, my leg off the ground, it pulls, extends my leg back this way, and gluteus medius and minimus pull out this way. Now, when my leg is on the ground, it controls the leg a little bit differently. It also controls my pelvis. So when I'm standing on my right leg, my glutes prevent my pelvis from dropping. Okay? So every time you take a step, the glutes have to fire. If the glutes don't fire, you get this action. So if every time I take a step, whether I'm walking or running or climbing stairs, and my pelvis drops, even if it's just a little bit, you create extra tension on the outside of the hip. So you can develop tendonitis out here, bursitis, which is inflammation of the bursa sac. You get impingement or pinching in the groin or the inside of the hip. So you can get an impingement syndrome there. It also side bends the back. So if my pelvis is dropping, my spine is curving, my low back, so you can develop back pain this way. The other thing that the glutes do when I'm standing on my leg is they control my femur. So if my glutes aren't firing when I step, then my knee is going to come in like this, okay? So that creates more of a chain reaction down below the hip. So again, you have tension out here, tension all down along your IT band, and runners all know about that. Compression here on the inside of the knee, more, or on the outside of the knee. Tension on the inside of the knee. You get your kneecap tracking poorly, you can get some subluxation there. Even down by foot and ankle. So your arch can start to collapse, extra tension on the plantar fascia. If you think about at the Achilles tendon, you have abnormal forces down there. So basically when the glutes aren't working, you have all these increased forces. If you think about your body and your skeleton as like a set of building blocks that are supposed to be aligned and move in a certain way, the proper alignment distributes all those forces equally. So when you get out of alignment and you're moving in an improper movement pattern, you just increase the forces in certain areas, and that's how you start to develop pain and inflammation and all that stuff. All right, so when you look up glute exercises, say you went online and looked up glute exercises, you'll find exercises like clamshells, leg raises on your side, bridges. But what we found through research, and also just through my clinical practice, is, people like to take the easy way out, right? So as human beings, we're kind of natural cheaters. So if your glutes are weak, or they don't like to fire, you're going to alter that movement just a little bit, and you're going to be exercising your back instead. Or you're going to exercise this little muscle here, tensor fasciae lata, that can contribute to that IT band syndrome, or your hamstring. And even if you're firing the glutes when you do those exercises, they still might not fire when you go to stand up. So they might not be working when you're doing your running or your walking. So I've kind of developed a screening system that I found to be most effective to see whether or not your glutes are working, and to retrain them and to retrain the movement patterns. So who wants to be a subject of my demonstration?
Joe go.
Everybody.
I'll go. What do you need me to do?
And you guys can, come on, stand up here if you don't mind. Face down. And you guys can try it to the side if you want to. So the first thing.
It's about my butt.
Show everybody first. Now,